Hi, I'm here with my client Lydia. We're discussing her options around her third birth. She had a spontaneous vaginal delivery 4 years ago, a cesarean section 3 years ago due to breech presentation, and is now pregnant with her third. And we're here today to discuss her options for this birth. Um, so she is a good candidate for a TOLAC, and yeah, we're just here to talk about our options today.
So I'm just wondering what things I should consider with both options.
For sure. Like I mentioned, your previous C-section was due to fetal position. The circumstances around that make you a good candidate for a trial of labor this time around. You have no contraindications to a trial of labor. And there's a few things that actually make you increase your chances of being a more successful candidate for a trial of labor. You're under the age 35, you have a BMI less than 25. And remind me, you had decided that you were going to opt for a hospital birth this time, right?
Yes.
Perfect. Really, then, what you should consider is what matters most to you in this birth. What would be your reasoning for both options? Do you plan to have more children after this? Um, and we're going to go through today a little more about each. So we'll talk about some risks and benefits. But yeah, does that make sense?
Yes, that makes sense. Speaking of benefits, what are the benefits of both options?
For sure. It's an opportunity with a trial of labor, to experience physiologic labor and physiologic birth, again, in your case. There's a really high success rate for trial of labor. Approximately 75% of attempted trial of labors, they ultimately result in a spontaneous vaginal delivery. Um, and then, like we mentioned in your case, there's a few more factors that will increase chances of that success. It's evidenced that there's a greater initiation and continuation of body feeding with vaginal deliveries, especially at the 3 and 6 month postpartum checkpoints. Um, it's evidenced to have a shorter hospital stay after a vaginal delivery than you would recovering from a surgery. Can be seen as a personal accomplishment to give birth vaginally. And there's also evidence that says improves your postpartum recovery and decreases your occurrence of postpartum depression when attempting a trial of labor. There are some benefits to an elective repeat cesarean as well. The biggest one, and something that we'll come back to, is that it reduces your risk of uterine rupture. The absolute risk that you would have a uterine rupture is less than 0.5%. But it's important to be aware that having another C-section, we would operate in the same area, and there would be less pressure on that scar during labor. And it would avoid, if we plan for you to have a repeat C-section, it would avoid an emergency cesarean section in the 25 approximately percent chance that your trial of labor did indicate that a C-section was required. Planned cesareans are evidence to decrease the risk of surgical infection. So there's that option as well. Does that make sense? Do you have any questions about that?
Nope, that all makes sense, but what are the risks of both?
For sure. It's definitely important to talk about those. So if you were to attempt a trial of labor, the biggest, most significant risk that we talk about is the risk of uterine rupture, which, again, like I mentioned, is less than 0.5% chance that that would happen, but it does come with some more associated risks. Mortality and morbidity are the biggest concerns. There's also a risk of hemorrhage, that you would require a hysterectomy, or brain damage or mortality of the infant. But those are very low risks, less than 6%, but they're important to consider. There's also typically during your labor, we would assess your specific risk and your specific labor factors to determine how we would listen to baby throughout labor. So there's the potential that we would increase our fetal monitoring by using the bands, the electronic continuous fetal monitoring. But it also could be the case where we think that everything is looking great and normal, and we choose to use intermittent listening to baby, which would be every 15 minutes with the Doppler. But with that, it's also important to know that there's some risk in delaying that assessment of baby's heart rate, as it is the first indication of uterine rupture is a decreased fetal heart rate. So those 15 minutes where we're not listening could increase the likelihood of mortality and morbidity. So it's important to know there are other things we are looking for, but there is risk with that. And then again, there is that 1 out of 4, or that 25% of cases of attempting a trial of labor that will, based on your labor factors, ultimately result in another C-section. Does that make sense? I'll talk about the C-sections as well, but that's a big one. Any questions there?
Yeah.
Okay.
No, that all makes sense.
Okay, perfect. And then if you were to opt for an elective repeat cesarean, there are risks just generally associated with surgery, specifically fever, infection, bladder or bowel injury, and or blood clots. But those are standard for most surgeries. There's an increased risk of experiencing pain during intercourse, evidence to be at about the 18-month mark, 18-month postpartum mark. There's risks if you were planning on having more children in the future. There's some pregnancy complications associated with having multiple C-sections, particularly placenta malformation or risks there, but also preterm birth and requiring a hysterectomy. And then, like I mentioned, the more C-sections you have, the exponential risk increases as well for chances of postpartum hemorrhage, abdominal adhesions, or pain at the site of your incision, increases your likelihood of having injury during surgery. And again, the risk increases that you would need a hysterectomy. And you're also, evidence says, less likely to practice optimal body feeding when having surgical births. Any questions about that?
Nope, that all makes sense. Is there anything else I should know beyond risks and benefits?
For sure. So I guess it's important to say that, again, you are a good candidate for a trial of labor. And the most current research supports a trial of labor as a safe option for most individuals who have had a prior cesarean section. But like I mentioned, there's a few things that we're unaware about the risks, and the evidence is yet to emerge about, specifically, like I mentioned, fetal monitoring and the safety around that, as well as if you were to require an induction of labor, we would at that time assess the risks of artificial induction of labor methods. So yeah, those are also just important things to consider.
All right. What would you recommend?
So it's important to say that this is really the extent of my recommendation, is this conversation and giving you all the necessary tools to make your decision. There is some really good material about attempting a trial of labor on the Association of Ontario Midwives website. And we can also talk about referral to an obstetrician if you want a second opinion or with a second midwife. Um, but ultimately, what matters most is what matters to you and how you want to experience this birth. So it's important to know that it doesn't always go the way we plan. We could plan a million different scenarios and we won't know, but um, it's important to have all the tools and all the information. So hopefully this conversation has provided you with enough information to start, and you can always come back and we can chat further
Right. Thank you.
for sure. Thank you so much for coming in.
Thank you for having me.
Bye.